Okay, welcome everyone. So now we are going to look at some of the high yield, very important questions arranged in chart form. And these questions, first one is hypothalamus nucleus that inhibit feeding is ventromedial nucleus. Now what happens? You can use this mnemonic: lateral nucleus make you lean, and ventral nucleus make you massive. Now when the lean of ventromedial nucleus of hypothalamus will be there, so you will become lean. So hypothalamus nucleus that inhibit feeding is ventromedial. That is why you become lean. So in this way you can memorize this. And another one is patient complain of ipsilateral facial anesthesia, loss of corneal reflex, contralateral hemiplegia. Lesion will be present at ventral bones. Now you can memorize this, that ipsilateral facial anesthesia will be there, loss of corneal reflex and contralateral hemiplegia because of ventral bone lesion. Graft rejection is primarily mediated by cytokine T cells. Graft rejection happens posterior external arcuate fasciculus. His another name is cuneo-cerebellar. I will make a detailed video on the tracts of the spinal cord and the tracts of the nervous system. And then cabergoline receptors are act on D2 agonist. Cerebral ischemia and cerebral blood flow leads to curve shift to the left. Decorticate posture lesion of the red nucleus, having hypertonia of elbow, flexor of elbow and extensor of knee. Thickest part of sensory retina is pupillary region. Pupillary region is the thickest part of sensory retina. Midbrain blood supply is posterior cerebral artery. Posterior cerebral artery supplies midbrain. Lymphatic drainage and external nose in the anterior nasal cavity is submandibular. Lymph node drain from here and external nose. And then for patient taking CVS drugs and having acute attack of glaucoma, now complain of metallic taste after taking carbonated drink, which drug he was taking, that is acetazolamide. Now if the same metallic taste is happening in diabetic drugs, then that drug will be metformin. So metformin causing metallic taste, also acetazolamide causing metallic taste in anti-glaucomatic drugs. So in this way one can conclude that acetazolamide and metformin both have metallic taste. So these are some of the high yield questions that you have to memorize, that you have to keep in your mind whenever a question comes in exam, as you could easily solve that clinical scenario. In the next video we will look at the detailed